Very good. Welcome, everybody. Welcome one, welcome all. And firstly, congratulations, because we have made it, hopefully successfully, to the end of day one of 2030 Insight Live. Yes! On one side of us sits our first day. On the other sits what will be a very busy second day. And somewhere in the middle sits this closing ceremony, sits an AGM, and sits some well-earned drinks refreshment. Yes. So on a mildly celebratory note and serious note, thank you. Thank you for leaning in to today. I'm joined on stage by three people who need no introduction. Why, you might ask? Well, and let me just say thank you for joining us, Ambassador Webson, Caroline Casey, and Dr. Babar Qureshi. Let's hear it for the three amigos, everybody. Now, why? Because why not? And it's time to recognize 9 outstanding individuals. They are our young systems leaders of 2025, and 8 of them are with us here in Kathmandu today. So first of all, a massive, I'll tell you more about them in a second, but first of all, congratulations one and all, our young systems leaders, everybody. And I thought it might be good to do a very brief roll call, get them on the stage, give them their certificate, if you like, and also shake them warmly by the hand. So please do come up as I read your name, and we congratulate you one and all. These are, of course, the result of nominations from around the world. We say congratulations to Ketumetse Timane. Well done. Come on up. Congratulations, Tujist Tulu Gelashi. Well done, Tujist. Congratulations, Amir Abu Adela. Congratulations, Abu. No, sir. Congratulations, Matan Arazi. No, Matan. Congratulations, Sabrina Fontvegera. Well done. Congratulations to you, Samit Sakib Kaur. Well done, Samit. Cheers, sir. Well done. Congratulations, Pati Janyani. Congratulations. And congratulations, Ting Fang Tang. Well done. Well done once again to one and all of our systems leaders. I'm making my way slowly but surely to the chair of the board of the IAPB, Babar Qureshi, for some final remarks. Ambassador, since we've got you with us, a final reflection on day one. It hasn't been a quiet day.
Not at all, Ali. It's been an outstanding day, crowned all by these 8 outstanding leaders. And I want to say thank you to IAPB, as usual, for putting on an event that goes way beyond. But more importantly, let us all march forward towards 2026 in the summit, and let us all work together for transformation to get where we want to get to.
Yeah. Thank you very much indeed, Ambassador, and for all of your support. Caroline, briefly, before we say goodbye for now, at 9 o'clock this morning, we were watching the wires. Will the Prime Minister be with us or not? Fast forward.
Can I just say, as we've acknowledged the leaders that we did today, I'm standing in between 2 amazing leaders. I just want to say that. It's an absolute honor for our chairman and the ambassador, and thank you for your support, both of you, for everything. But, and. So when we opened this morning, we talked about our ambition and the importance of us coming together and owning our voice and our light and our power to make things happen. And His Excellency, the Right Honourable Prime Minister, joined us, and that is a really big deal. It's a really big deal. But what's an even bigger deal that shows when people turn up, when people hold their voice and their space and their commitment, things happen. Because by lunchtime, headlining every newspaper in Nepal is the commitment of the Nepalese government to put eye health into their insurance scheme. And that is a really big deal. That is a really big deal. And Nepal has shown the way again. And that is the energy and motivation that we all need to see happen. So when people say coming together and joining together doesn't make change, that is proof that it does. So I just want to say thank you to everybody. What an incredible first day. And thank you so much to our hosts.
Thank you. Thank you very much.
Thank you, Baba. Now, Caroline, the ambassador, and I will leave the stage as you prepare to give your closing remarks. And to Caroline's point, we have in the room with us some of Nepal's leading civil servants who are the consistent force behind these amazing announcements. So thank you to each and every one of you. Thank you, Caroline. Thank you, Ambassador. Baba, we'll leave the stage for your closing remarks. Thank you very much.
Thank you. We're going off to dance.
Yeah.
Just going to step down here. So.
Dr. Madan is not here anymore, is he? Because I was not going to give a microphone to him again. And the other good news is I'm not yet a retired professor. So. Well, I think it was an incredible day, there's no doubt. I think we started off with His Excellency the Prime Minister, and not that he came, but he came on time, and everybody came on time, and that's actually a huge achievement, and I'll come back to it later on how this all happened, because it was quite a logistic thing to do that. To get everyone here in the room on time, and we almost, not almost, I think, the whole sessions ran on time. I mean, you must have noticed and you must have seen that the whole day was very well structured. And in each of these Insight Live meetings, we tend to go a bit more innovative and try and create things so that you all get new ideas and new discussions, and you are able to meet people and hear from them across the world. So for instance, one thing that certainly continues to be the theme throughout all these yearly Insight meetings is the progress on 2030 Insight Live. And that is something that is important, that we continue to monitor that. The other thing that was very innovative this time was the round table on refractive errors, cataract and diabetic retinopathy. And I hope you all enjoyed that particular session, which I thought was just great. I'm not only going to talk about the sessions I attended. There were other sessions certainly going on simultaneously, but there were just quite a few that went along. And more than that, the fact that we are in Nepal, and Nepal has got one of the finest eye care programs across the world. And that has not been an easy achievement over the last decades. I have been involved to quite some extent for quite a few years, or quite a few decades, I must admit. And some of the people in the morning that were there have been colleagues for a real very long time, and they are really good friends of mine. Just for the next 5 minutes, I'm going to ask our comms people to play a video on the development of the eye care in Nepal. So please, could you play the video? Thank you.
Almost 50 years ago, a project to eliminate smallpox uncovered another urgent crisis. Blindness was further reaching and more widespread than anyone had realized. This discovery marked the beginning of a new mission to eradicate avoidable blindness in Nepal.
And after the survey, we wrote to different countries to help Nepal. So many people came from different countries and they helped Nepal.
In 1970s, eye care service in Nepal was very preliminary stage. Government of Nepal has one central hospital in big hospital, one eye department, and few other regional hospital has few eye departments. That's what the total eye care service provided in the country. Therefore, there was a big long list of the cataract operations, like almost like 6 months in Nepal. And many patients who wanted to do the immediate cataract surgery need to travel to India in the Sitapur or Darbhanga.
Research revealed the critical need for eye care services, driving NGOs to tackle major challenges and create greater opportunities for more people to access care.
So with the support of the local participation and international agencies, we established different zones, different areas where there was a maximum prevalence of blindness to establish the eye care services in there.
The global support is needed to build that network, the network where they can share their learnings, their innovation and technology. They can also support the resources.
Two key priorities were identified to strengthen the system: technology and human resources.
Combining ophthalmic practice with the concept of technology is probably very, very effective, and it makes ophthalmic practice efficient, and we can reach more people. I would say that technology in cataract surgery, in retinal surgery, and in refractive errors, and right at the ground level. For example, use of smartphones, with slit lamps, and smartphones, having a small slit lamps in themselves, I think that's a great advantage.
Since there was a serious shortage of ophthalmologists, optometrists, and ophthalmic assistants, unfortunately or fortunately, since we were a part of the university, we could not take anything less than graduate programs. But many of our faculty members did take part in training the ophthalmic assistants, and that's the role they played. But our main focus was on training qualified ophthalmologists and optometrists.
Through these inspiring efforts, Nepal became a hub for innovative eye care, attracting both global and local expertise. A vision for a network of hospitals with specialty equipment and resources to cater to more people than ever before was born.
On 1st of March 1993, Himalaya Eye Hospital was inaugurated. 15th November 1996, Mechi Eye Hospital was inaugurated. From these two hospitals, so far, we have already served more than 8 million patients and performed more than 800,000 surgeries. These two hospitals are pivotal to change the eye care landscape in Nepal.
Not very easy. It is very resource intensive. We need lots of money to buy the equipment, to hire the people, to run everything. But at the same time, that should not hold ourselves. We need those establishments to really truly go into the crux of the matter and treat the patients.
The Nepalese government took a proactive lead in shaping and strengthening the country's ability to provide quality eye care.
Eye care in Nepal have come a long way from the prevalence of 0.8% blindness of 1981 to 0.35% in 2010 to 0.28% in 2022. With all the geographical, managerial, human resource, and so many challenges, we have come a long way. And that's been possible with very successful public-private partnership, support from different development partners, the willpower of the government of Nepal. Eye care have seen a significant growth and improvements in Nepal.
Our visionary leaders in Nepal, who have a very good passion, who had a very good dedications, who has a very good collaboration between themselves, has resulted in a significant reduction of the blindness in the countries.
What began with a few visionaries has become a thriving eye health sector driven forward by those committed to better eye care for all. As we gather here in Kathmandu, we remember these remarkable visionaries of the past and celebrate the progress made, the lives changed, and the ongoing efforts to ensure that eye care remains accessible to everyone who call Nepal home.
So you've seen the Prime Minister's commitment, further commitment this morning to the eye care for Nepal is based on a huge amount of actual field work that has happened over these years. And I know that there are many of you in the room who have been part of this achievement that has happened in Nepal. I have a very pleasant duty also to do at the moment, and that is to recognize a gentleman who is, to say that he's worked with dedication and commitment, I think is not enough. He's worked with passion, and eye health has been his passion. He's been the driving force for doing most of the mapping of eye health in the Sira region and doing a lot of RABs, even going sometimes across regions into areas of conflict. And if you hear stories about what he's done in those countries and the way he's carried them out, you need a very brave man to be able to do that. He's been very instrumental in bringing this meeting to Nepal, and has really played a huge role in gathering professional commitment and political commitment, and which has been very evident this morning that we saw. I just want him to know that his colleagues, both nationally and internationally, would like to thank him for his services. So IAPB, recognizing his passion and commitment and his meritorious services to eye health, would like to present him an award. And the gentleman is no other than Yoda Sapkota. Please come up. Ali, back to you. Thank you very much. Thank you.
Thank you very much. Thank you, Baba, and thank you and congratulations again, YD, for all that you have done with us and for us. Round of applause once again. Thank you.